We're talking about unexpected shocks here, and today we're going to talk about transfer programs, safety nets, and things like that. My paper here is co-authored with Jim Ziliak, University of Kentucky. He and I have teamed up on a bunch of papers recently over the past year on COVID and how the safety net has responded. All our work so far has really been on the general age population. So this one focuses on the older population. And happy to talk about this. So all our papers are really about how the safety net responded in this case to the pandemic. And that's a complicated question politically. It means both the federal government and the state governments, and there's a lot of response going on across different programs. We'll talk about individual programs recently. Just a couple of things about poverty rates. We are talking about the low-income population here primarily, although during the recession, some people who were in the middle class dropped down into lower income brackets. But we're going to talk about responsiveness primarily for the lower income population, or certainly the less educated population. Just a couple of facts here. If you look at poverty rates published by the Census Bureau, poverty rates for those 65 and older were about 13% prior to the pandemic. 16% back during the Great Recession, which is actually not that much difference. We had a recovery, of course, from the Great Recession through 2019, so the poverty rate for the older population dropped. I don't know what you think of these numbers. Most of us think these numbers are too high. The poverty rate is pretty low. The poverty threshold is a low number, and so if you don't have income up to that, you're not very well off. So we want to have that be lower. You might know there's a long-standing fact with the Social Security program moves more people out of poverty, across the poverty line, than any other. Forget all the transfer programs, food stamps, Medicaid, everything. Social Security does the most. And that's partly because it's so massive, and partly because there's still a lot of poor older families, individual families, which this audience knows as well as anybody. And a lot of people come into older age with almost nothing. And Social Security is their main source of income. So it's a very important program. Talk about that and what our data show on the Social Security program during the pandemic. The interesting thing, if you don't know, the big news is that the poverty rate actually dropped in 2020. The Census Bureau releases annual poverty rates every fall. And last fall, they released the poverty rate for 2020. And it dropped for the older population, dropped for the whole population. That went down kind of the same amount for everybody. That's generally ascribed to the $1.3 trillion spent by the government on the pandemic. The $1.3 trillion completely dwarfs what was provided during the Great Recession. Mammoth, that's covering everything, of course, not just transfer programs. It's covering paycheck protection, health programs, and things like that. So, but it was a huge amount of money, and so poverty rate dropped. So our numbers are all going to show big increases in transfer program receipt among the older population as well as the general population. So anyway, we're going to look at safety net receipt during the pandemic, and we're going to focus on the population from 50 to 74. Both the 50 to 61, which are generally still working, at least the majority are, as well as 62 and older, which includes some workers in the early parts of that range, but some retirees as well. So we're going to cut it into two groups. And what do we find? First of all, just to Jim and I and many other people have found that for the general population, UI and SNAP have been far and away the major programs. And that have increased during the pandemic and provided the most support, kind of astronomically more than anything else. And I'll talk a little bit more about why that is, because both of those programs are kind of automatic stabilizers, we call them, but also Congress added on some additional support for those. And the interesting thing here, or maybe this group is not surprising at all, but that there's a lot of receipt of both of those programs by the population 62 and over, not just the population below 62. The population over 62 includes some workers, of course, includes a lot of retirees. And not surprisingly, it's concentrated among the less educated population. They're more likely to have low income, both before age 62 and after 62, and that's where most of the increases we see. We don't find very many differences by gender. We do a little bit. We need to do more on exactly which programs. We count the programs aside from just dollars a receipt. What about other things like taxes and transfers? And we have a measure of what we call volatility here, and both increases in taxes. Taxes here include the earned income tax credit, although that's kind of on an annual basis, but also the economic impact payments, the EIPs, which were very, very important in reducing poverty and went to the older population as well as the general population, but transfers as well. We have a little bit on volatility, but the impact of the recession on incomes and on what we call volatility, which I'll explain, have been very important. Okay, so what are we going to do here? We're going to use the current population survey, the annual social and economic supplement, which is asked every March and collects information on income during the previous year. We're going to use the past 20 years, and the last year is 2020, which is the pandemic. We're going to look at that whole time period and see what happened in that last year to receipt of the programs. In the CPS, families are asked in receipt during the prior year of transfers. Taxes are actually constructed by the Census Bureau and by through the NBR tax sum model. People don't know, they aren't able to tell you what their taxes are. So that's computed, so there's always some error in that. But still, there is tax information on the file. We did do a correction for underreporting. It's well known that transfer programs are underreported. I've been working on underreporting imputations. We adjust reported income, receipt of benefits up to control totals, so that our totals, aggregate totals from the our analysis match those published by the government for total caseloads and total receipts. And we have an algorithm for doing that, and we can talk about that if you want. But it's very important. Everyone knows how much these programs are underreported. We have my colleague Jim Zeliak has done a lot of work on imputation. So I don't want to get into the weeds of data here, but imputations are very important. A huge fraction of the CPS respondent populations either doesn't know or refuses to answer the income questions, and it's a very big deal, and it really makes a difference. And we actually exclude people who are imputed, and we reweight the data to account for that. So talk about that. So we have a pretty large sample size here. So what are the programs we're looking at? The UI is the ones obviously designed to address unemployment, but Congress added major support to that in the CARES Act in March 2020, and then additionally in December 2020, and then again February and March of 2021. So a lot of money with UI, and of course that's only for people who qualify. There are a lot of very low income people who do not qualify for UI. Because they don't have enough earnings and employment in the past quarters that the states require. But SNAP automatically, SNAP is our closest thing to a negative income tax. Everybody's, if you have low income, everybody's low income eligible, regardless of age or family status or anything else. They've mostly eliminated asset requirements. So that's a very important program. Congress topped up a little bit in the CARES Act, but not a lot. And then there were more top-ups later, which aren't captured by data because they really happened in 2021. Social Security, that's a function of retirement. We heard yesterday that there were a lot of, it looks like there were increased retirements, so you should see some response there. DI applications are typically countercyclical, not receipt because it takes a long time for the application process. Medicaid, people lose health insurance. Medicaid is a complicated program. Some states are very generous and cover more people than others. But Congress told states not to terminate their people, so people on the roll, so that caseload went up. So these are too complicated. I apologize for this. But if you look at the top two, this is men 50 to 61. You can see for the top left figure, SNAP had that big jump up by education. The black line up the top is the least educated population. Huge increase in SNAP receipt during the recession. Huge increase in UI. the UI is actually went up for a lot of educated people across the educational spectrum, where SNAP went up primarily. That's because UI covers a lot of people who have earnings and they're somewhat educated. But you look at the other programs, SSI, Medicaid, Social Security, and SSDI. I won't take time to show you every graph here, but they didn't respond very much. Women, the interesting thing is there's not much difference here, and that's important for the older population because there are a lot of widows. But we didn't find much different. Big increases in SNAP and increases in UI for women too, 50 to 61. And for the slightly older population, 60 to 74, not as big. The interesting thing is you get increases there too. So it's not just confined to only the 50 to 61 for men and UI too. Now it's obviously certainly among the younger age groups in the 62 to 64 range, but it's major. And again, not much for SNAP and UI, a little bit, not for the other programs. I'm not showing the other programs here, but kind of the same for men and women, not finding any important gender differences here. And this volatility thing, and you got to get your head around this a little bit. During recessions, volatility goes up. What that means is that some people's earnings and incomes fall and other people's don't. So you get a big spread. Inequality really goes up because recessions always hurt people more at the bottom. And the earnings volatility separated here into older and younger. And we find the volatility went up, particularly for the younger 50 to 61. So in terms of earnings, so a lot of people lost their jobs in the lower educated population. But if you add transfers into that, in fact, it fell for the older population. In other words, that cushioned it so much that the impact of the recession on inequality was even smaller. And when you add transfers, it fell for the younger population as well. So taxes and transfers cushioned the flow in a very visible way. So we did do some work on state level unemployment responsiveness, and Courtney and talked about that yesterday. We didn't find that if you were in a state that had high unemployment, that you particularly got more transfers than anybody else, probably because the federal intervention was so important here relative to states. There's big differences across states in UI generosity, and not much in SNAP. SNAP's a federal program, so not surprising that there wasn't a differential state responsiveness. So in here, UI and Medicaid, very important for the general population, but also for the older population, including those over 62. Men and women about the same, most of them were educated. And the tax and transfer programs provided by the government, shown by the CPS to have a major impact in cushioning volatility and helping those in the lower part of the income distribution who suffered the most in the recession.